here's my take on the Dr Bawa-Garba affair. If you haven't heard about this, this is a junior doctor in the UK who was just in the wrong place at the wrong time, and unbelievably had come back from maternity. She'd been off for a year and was put straight on call into a busy shift with 2 extra doctors missing, and so she was covering the work of 3 doctors. It happens all the time. It's so dangerous, the NHS. And lo and behold, something bad happened. It's complex, but there was almost certainly a lack of leadership from the consultant above. There was it sounds like there was a failure to detect sepsis soon enough, which is a real shame in today's climate because it's so septic aware. But she just sounded like she was incredibly stressed by her workload. And then there was a mistake at some level. It's unclear, but unfortunately the kid was given a dose of enalapril, and that will precipitously drop your blood pressure if you've in septic shock, because basically enalapril is the connection between the heart and the kidney through the renin-angiotensin system. So this is critical in shock scenarios, because there you've got the kidneys telling the heart, look, we've got this problem with a lack of fluid, a lack of blood, and telling the heart to go faster, harder, especially harder. And as a result, that connection got broken and the poor little fella went into arrest, and then there were more cock-ups and cock-ups. Whole thing is just a disaster, and you know, your heart has to go out to the parents, your heart has to go out to the little boy and everyone else involved. But where one systemic disaster has become one personal catastrophe now, because this doctor, who's in no way more guilty than any other doctor who's ever lived in the world, who's done similar things. You know, every doctor out there is fucked up, every single one, and you just hope that you get away with it. You hope someone else picks up on it. You hope that if anything does happen, that, you know, the family can find forgiveness, really. The patient can find forgiveness. Hopefully it's the patient who needs to find forgiveness, but you hope. And that sounds like what's happened here is, sadly, from a lack of communication at some level. The parents seem to be very upset and very angry, and what they need to realise is that it's not really a person they need to be angry at, it's the system. It's a broken system, and you've just been mangled in it. So we all know it, all doctors know it. It's one of the reasons I very rarely work in the system, is because it's so mangled that it's liable to catch you in its gears and mangle you in the process. So it's a dangerous place to work professionally, the NHS at the moment. And this is what this woman's shown. She's got manslaughter for this. Unbelievable. Just unbelievable. Poor lawyers, I suspect, as well. Vindictive system. And yeah. So what can be done about it? Well, when I last put my revalidation in, the comments were interesting, because I was honest with the GMC and I was honest with myself, and I said that I wasn't actually a safe and, well, no, actually safe I said I was. I said I was not doing the best I could for patients, because the question was worded in such a way, it was like, if you aren't doing your best for your patients, why not? And I said, well, because basically the system prevents me from doing so. The system prevents me from practicing acupuncture to help patients to get them better. Unbelievable. The system does that. No individual in that system can explain why this is the case. So I put this, that basically I was failing my patients every day. But even if you don't even buy into that logic or belief system or whatever, the fact is, you know, at a systemic level we are. So I would recommend that everyone puts this into their GMC, revalidation, appraisal, the whole lot, saying that, you know, basically they are prevented from being the best doctor they could be. And you know, there are more extreme methods. I think the argument that the GMC is doing a service for doctors is no longer true. So why are we paying them? They seem to just be working for the public, and a vindictive legal system. So why are we paying you? Why are we paying you? You're not protecting us at all. I mean, if this girl, this Bawa-Garba, Dr Bawa-Garba, and I'm going to say doctor because she is still a doctor, if she isn't able to practice medicine because of the reason of this one harried, overstressed mistake that she sounds like she did in good faith, then no, there's nobody out there. Nobody can practice medicine. We've all fucked up like that. We're all human, and we've all worked in this broken system. And if you want to crucify every doctor out there, do it.